Everyone. Welcome to our virtual sales summit. As you know, we every year we do actually have a face-to-face sales summit here in the Detroit area, out west and up north. But due to COVID, we are constrained to doing this virtually this year. So what we have here today on this particular presentation is Aetna. And Aetna actually for 2021 have some great plans this year. $0 premium for PPO HMO, as well as a new MA plan, a new D-SNP in certain counties here in Michigan, and also enhanced benefits that are included with these plans. But we're going to leave all of this to Dan Dombrowski of Aetna and Angelique Hughes from Aetna to discuss all of these plans. All right, so folks, Dan, take it away, my friend.
Hey, thanks, Bernard. And can you guys hear me okay? Okay, good. All right. Try to make sure. All right. So, hey, good afternoon, everybody. The IAD team for allowing us to. So, this is going to be the overview of the D-SNP product in South. Plan is going to be available starting out Oakland and Wayne County, and there are roughly 129,000 people eligible in our 2021. So there is a lot of opportunity. One of the, I think, biggest advantages of our D-SNP, it does use the identical network as our current Medicare Advantage PPO and HMO network in Michigan, which also has nationwide coverage, with about 85% of doctors nationwide and 90% of doctors in network in the state of Michigan. And another nice feature of this HMO plan that we have, the new D-SNP, there are no referrals required. This new plan actually covers 4 levels of Medicaid for eligibility, and that is the QIMBY only, the QIMBY Plus, SLIMBY Plus, and then the full benefit dual eligible, as you'll see here outlined in the chart. So 4 levels of eligibility for the new D-SNP at Aetna. And on this slide, you'll actually see we do have available service for you as the agent to verify the eligibility on the D-SNP product by calling the broker services department. And you'll see the number there at the bottom of the page, option 7. The only thing you'll have to verify is 3 things, really: the Medicare ID number, the applicant last name, and date of birth. And this is just a quick overview of the D-SNP product line. I should say the plan itself, in terms of what's covered. So again, 3 counties, 0 premium, 0 PCP, 0 specialist, 0 outpatient, 0 medical deductible, and also a 0 drug deductible. One key point here is on our dental, because we probably have one of the better dental benefits on a D-SNP plan in Michigan, and I'll tell you why in a moment. It is $2,500 in dental for any dental service, both preventative and comprehensive. The only exclusion is teeth whitening. We also offer an eyewear allowance through iMed, and also all licensed eyewear providers. If your client were to go to an iMed provider, they do get the eyewear allowance at the point of sale. So the way that works is if the eyewear came to a total of any amount, $250 or less, they would have to pay 0, because that would be taken off at the point of sale. So that applies to all iMed providers. Our D-SNP product offers a $360 per quarter over-the-counter benefit from CVS, and that is again not per year. That is a $360 per quarter over-the-counter benefit allowance. We also offer the transportation benefits, 24 trips per year, up to 60 miles one way, with a 0 copay. We have a hearing allowance, $750 per year, and that is also an annual benefit. silver sneakers with a zero cost, and a meal program. If your client is hospitalized, inpatient in the hospital, upon discharge, they will be eligible for a meal program which provides 42 meals that are sent to their home upon returning home from the hospital. We also do offer a fall prevention benefit, which is a $150 annual allowance for bathroom safety devices, things that would help improve mobility. So that is also a great fall prevention benefit here as part of the D-SNP product. Transportation, as I mentioned, 24 visits, 60-mile radius, zero copay. And then we also have a personal emergency response program which provides 24/7 access, and that's a zero copay. I mentioned the over-the-counter, $360 per quarter. That's over $1,300 per year. Items can be ordered either by mail, phone, or over the internet. We also have the PAPA program. Not all the carriers have PAPA, and it is a nice feature because it's family on demand, 10 hours per month. Many different things that are included in this. A few noteworthy items, though, is the, just a companion, really, things such as watching a movie, like cleaning. They can do chores around the house, organizing. They can even do grocery shopping and prescription drop-off. So just a phenomenal benefit, 10 hours per month. We have the model of care team, which our D-SNP business manager will go through in a moment, Angelique Hughes, which is available to all D-SNP members who might need, case management, disease management programs. I mentioned silver sneakers with a zero cost. But again, I think one really big differentiator with Aetna is, again, the dental benefit. So $2,500 annual benefit, zero deductible. It does utilize the Aetna Dental PPO network, which is a pretty robust network. When we compared it to all the available dental offices in the state of Michigan, we do have roughly 80% of them participating. But the great thing about the dental plan, it's all preventative and comprehensive services, 100% in network, zero cost to the member, available day one of the program. So again, all dental services, the only exception is teeth whitening. All dental services, 100% in network, zero cost. Any services, even including endodontics and periodontics, you'll see here on the page, like root canals, a repair to a tooth, gum disease treatment, crowns, bridges, implants, dentures, all of the above included, 100% coverage. Many of the D-SNP carriers have exclusions on some of those major items such as the crowns, the dentures, especially the implants. So we have all of the above, oral surgery, extractions, restorative services as well. And a couple of points on the prescription drug program. We do have a 5-tier formulary, zero copays for tiers 1 and 2. And I'm going to show you on the next screen. You'll see the 3 different LIS categories and the MSP category. So again, Quimby Plus, Slimby Plus, and full benefit dual eligible and LIS category 3 will have not only a zero cost on Part D premium, coinsurance, and deductible, but also zero copays for not only brand and your generic drugs. And now we're going to touch base on a few of the characteristics of the dual eligible population. So at this point, I'm going to turn it over to Angelique Hughes, our new D-SNP business manager. And, Angelique, you can take it from here. I can go ahead and advance the slides for you. So when you're ready, just let me know and I'll advance to the next slide.
Okay, great. Thank you, Dan. And thank you everyone for participating today. So what I want to touch on first, Dan talked about the benefits of the D-SNP product. And what I want to talk to you about is the demographics, those who be in the plan, as well as the model of care. And I'm getting a lot of feedback. Can everyone go on mute, please? I wonder if that will help. So who is dual eligible? Dual eligible means the person is eligible for Medicare coverage as well as Medicaid. For our D-SNP members, they will be what we call full eligible. So they will have 100% of the state's Medicaid benefits in addition to Medicare coverage. And Medicaid will contribute towards some of the cost shares towards the members' Medicare Part B premiums in some cases and towards some of their co-pays and deductibles and co-insurances in some cases. Next slide. So what I want to show you on this slide is just some of the differences for those who may be more accustomed to serving Medicare Advantage members who are non-dually eligible, because there are some differences in the demographics and the backgrounds for D-SNP members, which are also in the Medicare Advantage program. So as I mentioned, we will only serve full duals. So this first column here shows that within the full dual population, 44.6% of that population does not have a high school education, compared to, if we go to the third column, under non-dual Medicare only, in that population, 14.4% of individuals does not have a high school education. Within our full dual population, we're looking at, I'm going to jump down to college. So 25.5% of that population have some college education, compared to our non-dual Medicare Advantage only population, where over half of that population, 53.4%, has had some college. Looking to the income status for our full dual eligible population, over half, 55.6%, live beneath the federal poverty line, compared to only 3% for the non-dual Medicare only population. So you can see here that from a financial perspective, this membership is a financially needy population. Next slide, please. On this slide, what I want to highlight are some of the age and ethnicity differences versus the dual population here in Southeast Michigan versus the non-dual Medicare Advantage beneficiaries. So if you'll see here, starting with age 65 and older, if you start all the way in the third column, you'll see that in our non-dual Medicare Advantage only, so that's your standard Medicare Advantage plan, that generally those are age 65 and older and over are in that plan. 88% of those are 65 years and over, compared to our full duals, where 46.1% will be 65 years or over. If you look on the next line, in our full dual population, over half, so we're looking at 53.9%, will be under the age of 65, compared to the non-dual Medicare only population, where only 12% of those beneficiaries are under the age of 65. So this is telling us that in this D-SNP product, the majority of the individuals that we will serve will be under the age of 65, so not your typical Medicare Advantage age member. On the next line, this lets us know that 60.6% of that population will be female. And next is race and ethnicity demographics, which I think is important to highlight as we're looking at serving the dual population, because it highlights some needs here in Southeast Michigan specifically, as well as some opportunities. So what you'll see first is that 65.5% of the individuals in the full dual category are classified as white here in Southeast Michigan. Now, for the US Census, in addition to Caucasian, individuals who are Arab American and Chaldean American also are classified as white American. And why do I say that? I say that because here in Southeast Michigan, we are home to the highest concentration of Arab Americans in the US, in the Dearborn area. So what that says, if we're looking at 65% of that population in the white non-Hispanic group, that means there's going to be some opportunities, for example, for brokers who might speak Arabic, who might speak Chaldean, because to expand the reach, that population is there, and we have opportunities to serve them. Followed by the next highest demographic will be African American, followed by Hispanic, followed by Asian Pacific Islander. And what I want to say here, under Asian Pacific Islander here in Southeast Michigan, we're talking, for example, about Japanese Americans, Chinese Americans, Filipino, those from India. And in a recent conversation with one of the leaders of the Asian American community here in Southeast Michigan, what she shared was that a lot of Japanese Americans, in particular here in Southeast Michigan, who are in need of Medicaid benefits, their challenge is language barrier. So they're not utilizing their benefits, or they don't have the benefits because they don't speak English at a proficient enough level to engage in those benefits. So again, I'd like to highlight another opportunity. If someone, or you know of individuals who speak Japanese, for example, we see that the need is here for that population and for our dual eligible plan. Next slide. So next I want to talk about the Aetna D-SNP model of care. Because we're a D-SNP plan, the Centers for Medicare and Medicaid Services requires that we come up with a model of care which breaks down demographics of our population. How are we going to provide care to that population? How are we going to see that they meet certain health incomes? Because in general, this population is one of the most sickest populations that there is. On average, every person most individuals who are dual eligible suffer from at least 2 chronic conditions. If we're looking at ages 65 and over versus 65 and under, the number one condition that dual eligibles, regardless of age, suffer from is high blood pressure. When we're looking at age under 65, one of the main things that population suffers from is depression, psychotic disorders, compared to those 65 and older who are dealing with more things like heart disease and things that would impact an older population. So because we are tailoring care to this very physically needy population, it's very important that we assess their health needs right away when they're enrolled in this product so that we can help meet their needs. So part of our model of care includes a care team. So every dual eligible member is going to have what I consider VIP treatment. So every dual eligible member will be paired with a registered nurse, which will be their care manager. They'll have a licensed clinician, a care coordinator. They'll have an interdisciplinary care team, and that team looks at pharmacy needs, nutritional and behavioral support. And right when the member enrolls in the plan, that member will have an opportunity to take a health risk assessment with the care coordinator. And it's very critical that that health risk assessment is taken, because that's what we need to use as a baseline to determine the plan of care that we're going to structure to help meet that member's needs. And studies have shown that with D-SNP plans, typically if that member does not take that health risk assessment within the first 30 days of enrolling, they're at a higher risk of lapsing and leaving their current plan for another provider. So from an agent perspective, we really want to encourage that as you're enrolling members, you encourage them when the phone rings and you see it's from Aetna, please answer, because you're going to have a care coordinator who's going to call and check in on you and take a health risk assessment with you. And then once that health risk assessment is taken, the member and the member's care team will put together an individualized care plan. So they're going to, again, looking at how the member assesses his or her health, they're going to determine the ways to meet those needs. Part of our model of care also includes transitional care for members discharged from the hospital. Our members get access to all Aetna clinical programs. We're here to partner all along the way with navigating the healthcare system. Earlier, Dan mentioned about the nurse hotline that's available 24/7, and that the member's going to have a connection to local services and resources for social supports. So we really have a strong model of care that's targeted to meet the needs of each of our members in this D-SNP population. And back to you, Dan.
We also offer the Ascend platform for remote enrollment. We believe that Ascend will be more common this year than probably ever before. So if you would need to go through another Ascend training, if you've never been through one, we'll be offering some refresher training coming up here in the month of September, and I'll show you a website where you can sign up for an Ascend training. We do have a few really cool enhancements. A couple of them being that we now will verify the Medicare number right at the time of the application, so it'll say verified, and then also the Part A verified in real time, and that is right in Ascend. We also have a brand new feature that is, I just found out on Friday. Within Ascend, at the end of the application, after it's been submitted, there is an option for value-based enrollment, which is your option to earn an admin fee. And if you complete the health risk assessment, which is a pretty brief questionnaire related to health and routine care for your client, some of them are yes or no questions, you are going to get a $70 admin fee that is payable to you for each application you complete with an HRA, health-related questionnaire. And it's going to pop up at the very end of the application with an Ascend. After you've submitted the application, it will say, congratulations, your application has been successfully submitted. And then on the right side, you'll see in the screenshot on the left, it will say value-based enrollment and, select for language. And then you've got three options: agent complete, schedule call, line. If you click on agent complete, you are going to, the HR questionnaire will pop up on the screen. You will ask the question. You click on submit, it's transmitted to Aetna, and then you will get a $70 per application admin fee directly. The other option is schedule a call. If they want to schedule a phone call, that's another option with a wellness advocate. That is a $10 admin fee. So we do highly recommend you complete the questionnaire for the agent complete option at number 1. Again, the broker completes the value-based enrollment for a service fee of $70 if the health risk appraisal questionnaire is completed. You will not receive the service fee if it was canceled or partially completed. You must complete the full HRA. I believe it was about 10 or 15 minutes. So to earn $70 for 10, 15 minutes of your time is pretty nice. I mean, that's $300 an hour if you do the math. So a great way to earn extra money to put back into your business, earn on marketing, or use that money however you want. Again, if you schedule a call with a wellness advocate over the phone, that is a $10 service. So we're really excited about the value-based service fee, and we increased it from $50 up to $70 this year. So that's going to be effective starting on October 15th. So the next steps from here are certification. If you're not yet certified, we do accept AHIP only. We don't accept Pinpoint or Gorman. The certification is done online in step 1 on the website, which you'll see on the screen. The only other portion for selling Medicare Advantage is the I would be happy to, I will be getting a RSVP sheet from Bernard, so I will, make sure you get credit for that. And then you'll get a ready to sell notice letting you know that you are ready to sell, and you can order your enrollment kits and submit enrollment through Attend. I did mention pre-ordering enrollment kits right in Producer World. That will be available starting this week, Thursday the 3rd. The target delivery date for those are right around October 1st. And it is a first in, first out. So the earlier you get your ordering, the earlier you will get your enrollment kit. Just a reminder, our Medicare Advantage and D-SNP commissions are paid out at the maximum CMS allowable commission rate, which is $5.39 for new members, $2.70 renewals. Now, when you add in that $70 admin, you are making over $600 per application. It's actually $609, I think. So you are, it's over $600 for new members. Really, really nice. That is a 6% increase from last year. Again, our value-based enrollment went up from $50 to $70 per application. For your broker service support contact, we have Lynn Peterman, who is very fortunate. Lynn does an amazing job working with brokers and very quick to respond. She's dedicated to the state of Michigan through the broker as an extension of the broker service department. She can check on any ready to sell status or inquiry that you might have. You just need to submit the national producer number. Anything related to commissions, contracting, onboarding, ID cards, provider searches. If you put the wrong information on an application, she is here to assist you, and her information is listed at the top of the page. And then, of course, my information and broker service department is also there. And then I mentioned we're going to have some upcoming webinars. We will be doing the Medicare Advantage 2021 overview, which you can sign up for at the website here on the page, Aetna MedicareAgencyTraining.com. We have some great enhancements, a new MA-only plan for veterans who have served our country. It's still premium with a $35 back, $2,000 in dental. And so we encourage you, all of our embedded benefits on the dental go up on our Medicare Advantage plan. So the plan did over last year's plan. We also will be offering several Ascend trainings, enhancements, and a full demo of the online application process. And if you sell the MedSup products and ancillary plans, such as hospital indemnity, cancer plans, things of that nature, we will be offering those trainings on that site too. We have a new Ascendo MedSup product that has a 14% household discount. So we encourage you to come check those out. And this pretty much wraps up the product portion of the product training. So we hope that you have clients who might benefit from some of the features and advantages that brings to your clients. And again, I want to thank everyone, and IAG especially, for getting this set up today. And if there's any questions at this point, we can open up the lines, and myself and Ed are here to help answer any questions. So anything here from the audience? Okay, I'm not hearing any questions. Anyone will give you another opportunity. If there's any questions that you might have, please feel free to ask now. Otherwise, again, want to thank everyone for being on the call today, and we look forward to a great AEP. And I wish everyone best of luck this AEP. Thank you so much, and everyone have a great afternoon.
Thank you.
All right, folks. Dan and Andrew, are you still for your presentation? Not. Let's see if we have any questions for you all. And I know this is a new format for everyone, and sometimes bandwidth just doesn't work out right. But what we're going to do, we will clean this presentation up. It will be posted to our YouTube page. And everyone that is on the presentation, I will forward a copy of the presentation to you. And if you have any questions, email me those questions and I'll make sure I get those on over to Dan and Angelique. So Dan, Angelique, thank you very much for your time. And you know, this is the virtual world is kind of a challenge for us these days, but we really appreciate everything that you are doing, and we all, unfortunately, we all have to come with the times now. So with that again, IAD, Insurance Advisors Direct, we do thank you for attending the Aetna portion of our sales summit. If you're scheduled for the other portions, those will begin shortly. So if you have any questions, reach out to me at 800-381-0977, extension 112. All right, folks, thank you, and you all have a good rest of your week. Bye.